Hey everyone, welcome to Body Basics, where we're going to be talking with Dr. Jaami and me, Kindall Goetz, and we're going to be talking to you about a topic that actually really surprised me at first when it came to weight loss and to overall health and self-care, and it was the discussion of iron. And Dr. Jaami brought this up to me. We were chatting back and forth through text, and when she really explained to me the value of getting enough iron in your diet through a mostly whole food first, plant-based focused approach, I was like, everyone needs to know about this, especially if you are feeling fatigued and tired and sick and just run down. It might not just be the fact that you need more coffee or some more energy drinks, but it might actually be something going on with your deficiencies, especially if you are somebody who is looking for sources of food that don't just come from meat or from the traditional standard diet or supplements. And so I want to have Jaami jump into this. Tell us, why is it so important to get iron, and who is this talk really for?
Well, I'm glad that I talked you into talking about iron, right? um, I actually feel like a lot of people ask me about, oh, they're tired. I got my labs. I see that I'm a little bit anemic. They say I'm a little anemic. What should I do? It's for those people that might want to hear this and look over their labs again. It's for those people too who are just struggling, especially women, around the time of their month when they might have their menses, or when they may have had their menses, if they're past that point in their life, when they may have a little dip in their red blood cell count, and or if you've had recent injuries or traumas, or you're having sports injuries where maybe you're getting injured and you have a broken bone. All those things affect your red blood cell count, your serum, we call it the serum blood. And so that's who this talk is for. And iron is an essential role. It has an essential role in the body for vitality and for health and for healing. And it is just an essential mineral that I think a lot of people feel like they can only get from meat or from an iron pill. And so that's why I want to talk about it today. Really, in the body, iron has kind of the biggest job, right, is oxygen transportation. So when you think of your blood, right, it's 4 components. You have plasma, platelets, white blood cells, and red blood cells. And so the red blood cells have a protein in them called heme, and that is what oxygen can attach to be transported to all of your tissues. So it is not just your lungs for breathing, but it is all the cells that you regenerate every day need oxygen to function. Your brain needs oxygen to function. Your muscles, when you are in a heavy workout, need oxygen to function. Or if you're just walking across the street and doing your daily activities, your ADLs, we call them, you need oxygen. So without iron, enough iron in your blood, you can't transport oxygen efficiently. So you're going to feel fatigued and you're going to feel weak because you just don't have enough oxygen to feed your body and to fuel your muscles and your cells.
Wow.
So that goes with, right, energy metabolism. Iron is involved in energy production at the cellular level. So if your cells are well, you will heal well. And we talk about that a lot with Juice Plus, right? That we are healing at the cellular level. And so iron at the cellular level helps our bodies convert calories into usable energy. So if you are working on losing weight, guess what? You got to be able to metabolize the calories you're taking in, right?
I would have never put these together, but when you were talking about how we need this to just have overall cellular function to do the whole chain process, of course, it now makes sense. Like if you want to boost metabolism, higher energy, regulate, does it help with your appetite or anything to do with?
Well, if your digestion is healthy and you're digesting in a timely manner because your cells and your digestive system are functioning optimally, then it can affect your microbiome, which then affects your gut-brain axis, which will enhance the ghrelin and the leptin, right? Those hunger and fullness signals, hormones that we create. And so, yeah, it's going to help your digestion. The other thing is everyone's looking for better focus and memory and ability to learn, right? How many adults now that have grown up with the ADD, ADHD diagnosis, and how many kids are being diagnosed with that? Um, and what we really want is focus and energy. And I don't know if you remember, but a few decades ago, the oxygen bar came out, and so get more oxygen. But if you don't have iron and appropriate heme on the red blood cells, it doesn't matter how much oxygen you have because you can't transport it around really easily. So iron will support brain health and cognitive function. So that's another thing that I love.
I'm telling you guys, isn't this like, it's like, of course we need iron in our food and we need to be eating this. So do you find, what are the signs of low iron then? What are some of the like dead giveaways that somebody might be experiencing?
Well, fatigue and tiredness that doesn't go away with extra sleep, with resting, that doesn't go away with more hydration and more foundational kind of functional foods, not junk food, not extra caffeine. But if you are having fatigue and just pallor, that means like being really pale. And have you seen your own face when you feel sick and you're just really drawn? Drawn meaning like the color doesn't look quite right. You have lots of dark circles regularly. Those could be small signs, but just some of the basics of muscle and tissue, just fatigue is one of the biggest things. Also for women, right around their menses, they may have a mild bit of anemia every month, and that is not uncommon. But what would be great is if we on the regular increased our iron foods at that time of the month, and there you go. Or if you have an injury that caused excessive bruising or a broken bone, then you are going to be in need of more.
Wow. So is there a big need right now for people who are maybe not absorbing iron? And is there a connection that you can make as to maybe why people are maybe taking iron supplements, or maybe they're eating meat, for instance, as a source for iron, and then they're still having these symptoms? What could be going on with absorption?
That's a really good question, because whether you're supplementing or you're trying to get it through food, there are some things that will block absorption of iron. So timing is fairly important with your iron. If you're going to have foods that are high in iron, you would want to have them with other foods that would be high in vitamin C. So you talk about this a lot with super starch and the foundational foods, right? Bell peppers, dark leafy greens are going to have a lot of vitamin C. Strawberries, citrus fruit, those can all enhance your iron intake. If you're taking a daily vitamin C supplement or a vitamin D3 supplement, that can, change that as well. Some of the things that, though, will decrease iron, reduce iron absorption, would be coupling your iron with calcium. So if you're taking an iron supplement, or if you are really focusing on iron rich foods, you may want to do them separate from the things that you're getting your highest calcium from. So now we've talked about this. You and I don't really do dairy, but most of America eats a lot of dairy, and many times they're covering their meat or their beans with a bunch of cheese. And so that is going to actually reduce your iron absorption. So if you're taking iron, or if you're trying to get high iron foods, you would want to have them separate, separate times of the day from your really high calcium foods. Or if you're on one of the calcium supplements like Fosamax or one of those things, you would want to take it separate from the iron supplement you might be on, or the high iron foods. Also, a really common one, who doesn't have a cup of tea or a cup of coffee, right? The tannins can block iron uptake. So you would want to wait at least an hour after having that iron-rich meal to have your coffee or tea. So how often, especially right around the holidays, which we're moving into, you have that big piece of poultry or red meat, or a big piece of fish, or you have a big thing of lentils or legumes, and then afterwards you have coffee or tea. Wait about an hour for that. That's such a great way, one, to get in touch with your hunger fullness cues, but also to reduce the amount of tannin that you're taking in that could block it. And then there's medications, the acid reducers, the antacid, the Tums, the the protein pump inhibitors, the Nexium, all of those ones that you may take to reduce stomach acid. They're going to hinder your iron absorption. So that's something you would want to talk to your prescriber about, or someone who recommended those to you, so that you could have those separate. And iron, it's so important for your body to function well, and understanding your iron levels. If anyone wants to go into that, you can get labs to look at iron levels, and I'm happy to come back on and we can talk about that, unless you have a question about that now.
That's a great place to even pause for a second, because I know there's a lot of people whose wheels might be turning like mine, where I'm like, well, now I'm curious. Am I getting enough iron? Am I absorbing? And I think something that would be really important to just share is that Jaami, that is her specialty, as she is a nurse navigator. And so she is able to help people get the paperwork, get the blood work, go through it with them, and just to simplify and actually see areas that might be overlooked as normal, healthy levels that might be seen okay within a doctor's office, but really could be an underlying issue that could be symptoms of other things happening, or just really connecting the dots together. And I love that Jaami has a food first approach when it comes to healthcare, self-care, and love. And so I would love for you to share about, where do we get iron in our food?
Yes, absolutely. So everybody knows about the heme sources of iron. Remember, I talked about hemoglobin. That's the part of the red blood cell that transports oxygen around. So the heme sources are usually from animal sources, and they are, absorbed without really much help if your gut is healthy, which, puts a little bit of a break in between for a lot of the people in the U.S. But that would be red meat, poultry, fish. Of course, all of these things raised as cleanly as possible, without antibiotics that are going to interfere with the absorption, without toxins from the food sources and from the water sources, which is hard to find. Now, there are non-heme iron sources that are found in plants, and they do require you to eat them regularly for full absorption. So let's talk about lentils. Some of the great dishes that can be made, if you're looking at Mediterranean, Indian, a lot of the kind of middle of the world, equator kind of countries do a great job with all of these sources of iron. But lentils, chickpeas, beans, right? Black beans, white beans, garbanzo beans, that's chickpeas. I know you and I love beans. Those are the foundational foods, right? From your Superstarch program. It really shows people how to eat these. Leafy greens, spinach, Swiss chard, kale, arugula, all the things that you and I have an affinity for. Nuts and seeds, and tofu, organic tofu only, please. And also, it can be from fortified grains. A lot of times when you go online on the internet, it'll talk about fortified cereal and fortified oatmeal. I don't love fortified foods like that. So I would just go for, as close to the grain as you can when you do that. But you know what brought this up? I just have to tell you this because it's kind of funny. Thinking of this all came up in my mind because we were carving pumpkins this week, and one of the best seeds to get iron from are pumpkin seeds. So if you have like that goopy hand like I did this week of all these seeds, clean those out, dry them, and roast them in your oven with your favorite spices, because they are an amazing source of non-heme iron, plant-based iron that your body can absorb. And they have so many other nutrients too. And it also came up because my daughter thought, well, why do we even eat the pumpkin seeds? And then in our lessons for school, for some of the homeschool, we're studying the human body this fall, and we had a lesson on blood. And I was like, here are the 4 components of blood. And then I said, we were talking about the red blood cell. And I said, it transports around oxygen on heme, and you get iron is what gives you heme. And she was like, iron? I thought iron was just made for like swords and cast iron pans. And she was like, am I supposed to eat a big piece of metal?
That is
And
so
I
cute.
laughed. Oh, it was so cute. I laughed right out loud. And I said, "No, iron is a mineral, an element from the earth, babe." And she was like, "What?" And I said, "Actually, we have to have iron in our bodies to function." And she was like, "So if we just like attach something metal to us, would that do it?" I mean, this is like lower elementary, early biology, right? So, but the fact is that she asks these questions because she's not inhibited and she knows she can ask me anything. But you would probably never ask that when your doctor says you need more iron. And some of
Right.
the people listening might be maybe feel a little bit self-conscious to say they don't know how to get iron, why they need it. And so because I was explaining this to my 10-year-old, it worked, which is
We have
great.
a really great question in here too from somebody who's
Oh,
not
okay.
being shy, who's asking a question about iron. And he said, I have bad acid reflux. What would you recommend to help with my iron while be able to continue handling my acid reflux? Great question.
That is a great question. Well, the follow-up question is do you take one of the antacids on a regular basis, or the H2 blockers, or the protein pump inhibitors, one of those medications, either over the counter or prescription? That would be my first question. And maybe that person will answer back. But if you are, what I would do is I would
He said,
take,
yes, he is. Yeah.
he is, okay.
Yeah.
So,
Perfect.
yeah, good timing. Okay, so you would want to take that multiple hours before you're going to eat an iron heavy meal. So what I would try to do is say, okay, I'm going to take, if I'm normally used to taking that medicine in the morning, then I would schedule your lunchtime or your dinner time to be your heaviest iron based meal. And that sounds maybe hard because you think, oh, I'm not going to eat a big piece of meat. But all you really need is a foundational superstarch style meal, like a whole base plant meal. And so think about the greens you can put on your plate, then open up a can of beans, really rinse them, put that on, maybe even start to grow sprouts. Or if you don't do sprouts, start sprouting, because the grains and the nuts and the seeds that you sprout actually have a higher absorption rate for iron. So Kindall, actually, last weekend, she and I were together at a retreat, and she sprouted lentils. Is that right, Kindall?
It was. And they are the highest protein source too. And they're so good.
So high in protein, high in iron, and you could make that your super high iron meal away from your acid reflux. And then if you would like to work more on how to get off one of those medications, one, you could talk to your healthcare provider. If they're open to that, hopefully they would guide you through it. But if not, connect with me and let's work on your food, because there are definitely things with your acid reflux that you can do in terms of food timing, the foods that you eat, like even just a few minutes before your main meal or before your breakfast and your meals, that we could work on together. And there are some herbs that you could use instead of the medications that just kill that acid. And when you kill the acid, the food in your stomach doesn't digest as well. And guess what? If it sits there a long time and you start moving or change positions, it's going to reflux up and it feels like it burns. And so that's kind of what acid reflux is. But hopefully those little tips helped you. Thank you. I'm so glad someone asked a question. Perfect timing.
Yeah, I know. Come on and ask more questions because it's nice to be here to be able to actually in person answer things. And especially when somebody is trapped in a cycle
Mm-hmm.
where they don't know if they have options.
Yeah.
And sometimes we just get so busy with life that we forget that if we don't change something now, what will this keep progressing to later on?
Yeah.
And people younger and younger are getting on medications. Oh, that's awesome. Thanks for saying that, Chaz. Great info. Thanks so much for your input. Last question. What is your personal favorite source of iron?
Oh, I love that. Well, my kid's favorite source of iron is raisins because they're sweet. But my personal favorite are lentils and sprouts. I love alfalfa sprouts, and now since Kendall introduced me to Did I say lentil sprouts? I love alfalfa sprouts. But now that Kindall introduced me to lentil sprouts, I have some sprouting right now and I'm going to do it. And sprouts are super easy to grow. We should do another quick demo on here on how to do sprouts because it's so simple and they cost so much at the store, but you can literally do it with seeds and a jar of water at home.
We could do that next week for sure because that's an easy one to show. Yeah.
Kindall, what is your favorite source of iron? Now that you've been thinking about it a little bit more as Halloween comes.
Ooh, I know. Well, I've noticed, so I hear a lot of women talk about when they get close to their menses, it's like that craving for dark chocolate arises or for like sweets and for sugary. And what I have found is when I add more beans, when I get more heavy with I actually really love black beans. And I will even make foods like that black bean, sweet potato, pumpkin seed brownies. And they are foods that are foundational. I know they're so good. And I will make foods like that because I want to still be meeting myself in the middle. I still have that craving. And I will even add some Juice Plus chocolate complete shake to the mix. So I'm adding even in more sprouts and pumpkin seeds and some ancient grains that also are loaded with this iron that we're looking for. And so I'll just listen to my body and go, it's time to make some brownies. Let's go do that. And sprouts. I really do love sprouts too. I could eat, sprouts are just so full of energy and they just taste great on everything. And they just make food look fancy and fun. It's like confetti on top of your food. So I would love to ask
you. I'm glad you mentioned the Juice Plus Complete because I kind of forgot about that. And the reason that the Juice Plus capsules themselves have such a variety of plants that have iron in them, and it's not removed. They don't remove it during the the drying process of the fruits and vegetables. But it's hands down the best way that I have seen for patients and family members to get over that hump of anemia and or over that hump of even just creating a new gut microbiome, which is a great way to decrease acid reflux from that question. So, and the Juice Plus Complete does have the plant powders in it, so you are still getting iron from it. So
I would love for you to share too, because I think supplements is a big topic right now that a lot of people, do we supplement? Do we not? When is it important to supplement? And then what supplements do we really want to be adding in? And I know we have talked extensively about certain ones. So what is your professional opinion on that?
The most researched supplement in the world is Juice Plus. That's really the only reason I ever started taking it myself or recommending it to patients over, 20 years of being in healthcare. I have taken a whole slew of supplements and recommended them, but the best overall one is Juice Plus because we know that it's absorbed. We know that it changes the microbiome. We know that it changes the cardiac vessels. We know that it improves lung function. It improves insulin resistance. And so all of those things together with the research show that that's the best one. If you are someone already taking Juice Plus and you're still struggling a little bit with iron, the only one that I ever recommend is a liquid iron called Floradix. And because it is absorbed, it is not tasty, but it is well absorbed. And so I do have some women and sometimes pregnant women who I recommend that to the week before or the week of their cycle. Or if they're just after it post-injury or post-surgery, maybe to take that. Other iron supplements, though, from a prescription, one, are super constipating and are usually not well absorbed. So I always do a food first approach, like you said. Then I always, as they're adding in the foods, then I have them add Juice Plus for 3 to 4 months. And if that is still not changing their red blood cell count and their iron counts, then I have them do one of those liquids. But to be honest, I haven't seen the need for the liquid in a long time in people, which is great.
Well, I think what's cool too is you brought up about the red blood cells, and something that has really caught my attention about Juice Plus is the fact that it is paired with science, even for the amount of length that you get your shipments.
Oh,
It is, can you talk about that some? I think that is so fascinating.
Yeah, Juice Plus ships the capsules, the fruit, veggie, berry, omega capsules, and even the gummies, if you get that format, in a 4-month supply. And they do that because that coincides with the research they have done on the quality of cellular recovery. The life of the red blood cell is approximately 120 days, which is about 4 months. And so they want the company did its research with that in mind. And so that's why they ship it. And they want people to commit to that 4-month period so that they have a whole new set of red blood cells at the end and when their next shipment comes. And so they can feel better every day. And I saw the person who asked the comment that they had been doing Juice Plus a couple of weeks and they're feeling better each day. So just imagine how you're going to feel at 4 months and 4 years. Then you can hone in on really what are some of the main problems that you are having once you have the support of the variety of 30 fruits and vegetables. And as you start to get the 10 to 13 servings of fruits and vegetables you need every day, just with that Juice Plus helping you bridge that gap. So that's my professional recommendation for starting in supplements and food, the path of journey to food health.
Yes. Oh, that is so good. Thank you so much for sharing this and bringing awareness around iron and fatigue and energy. And especially too, as we go into the season where more of us want to feel energy, but we might be burning the candle at both ends with lots of sugary food, lots of caffeine, lots of just foods that aren't based in fruits and vegetables, and how this could really be a bridge to help people through this holiday season to not come out on the other end sick, tired, and run down.
Yeah. And just remember, your best strategy for your health, your wellness advantage the whole season, right, is a food first strategy. And I just want to put in a shout out to Kindall, right? She has created an amazing mindset for food, health, and weight solution program called Superstarch, and foundational foods for you, whether you're a foundational foodie at this point or you're not. It is a great way to start to change your outlook and see food as a weapon for your health, for better health. So I'm so glad that you took me up on talking about iron, this seemingly boring topic, but so vital to your health. So thank you, Kindall, and look forward to seeing you next week.
Yes, yeah, I look forward to. We'll bring Jaami back on here and have her speak more on body basics. And if you have questions about your health or about blood work or about any of these topics, reach out to us because we would be happy to talk about things that are prevalent and most pressing to you. So that's what we're here for. We love doing this. We love sharing the gift of health. And we will talk to you guys later. Thank you so much, Jaami. Have a good day, everyone.
Have a great day.
Bye.
Bye.